Alright everybody, welcome to my Exam 1 Essay 3 video. Today we're going to be talking about the ANS. The ANS is just a branch of our PNS. So in our nervous system we have two different branches. We have our CNS, which is going to make up our brain and spinal cord, and our PNS, which is essentially all our spinal and cranial nerves. Then branching off the PNS we have our ANS, and then our somatic nervous system. And your somatic nervous system is what innervates, say, skeletal muscle, our arms and legs. And then our ANS can be branched out again to our sympathetic nervous system and our parasympathetic nervous system. And so our ANS, that's going to be involuntarily controlled, so we don't have to do anything to innervate it. Our body just does it. While our somatic nervous system, that's voluntarily controlled, so we have to essentially innervate our own skeletal muscles. Okay, so we're going to kind of break it down a little bit, try to separate off how to differentiate them and all the receptors and everything like that. So starting here, we have our spinal cord. And we're going to start there. And we're going to start with our somatic. So we're going to draw our somatic in red. Sorry if my board's a little messy. Looks like lots of people have been using it. But anyway, so our somatic neurons, or I guess the somatic pathway, that's only innervated by one single neuron. And those neurons, or the cell bodies of those neurons, can be found anywhere within the spinal cord. Okay? So just anywhere in our spinal cord we can have our somatic cell bodies. And those, just using one neuron, are going to go out and they're going to synapse whichever muscle they are innervating. Okay? That's it. So our somatic nervous system, found throughout the spinal cord, it's just one neuron going out to their effector, which is usually skeletal muscle. Okay? Now let's move on to, let's do our sympathetic. I'm going to need that one anymore. Excuse me. So our sympathetic, that's just going to be found here in our thoracic region. Okay? So think somatic, think thoracic region. From about T1 to L2 is going to be our sympathetic nervous system. And also within that, I guess another way to remember sympathetic nervous system, remember fight or flight. So that's what innervates kind of your fight or flight response, like if you're getting chased by a cougar or something like that. Okay? It's found within our lumbar, and there's a few different pathways that this can take, but one thing to remember is that your sympathetic and your parasympathetic, their pathways are used by, or innervated by two different neurons. So they'll have a preganglionic neuron, which is the neuron before the synapse, and then our postganglionic neuron, which is the neuron after the synapse. Okay? So going through our sympathetic, there's a few things it can do. So first, it can come in and it can synapse here at our sympathetic chain ganglia. Okay, just right off the spinal cord. So we can have a short preganglionic neuron. It's going to synapse in our sympathetic chain ganglia. And then this postganglionic neuron is going to be unmyelinated. Okay? And then that'll go and synapse with its effector. And in this case, this effector, it could be our erector pili muscles in our skin to erect our hairs. It can be like glands, or it could be blood vessels. Okay? So it's going to go out and it's going to innervate those. Okay? Another pathway it can take, let's try it out here. So this is going to be our diaphragm, this is going to be our thoracic cavity, and this is going to be abdominopelvic cavity. Okay. So another thing that it can do is it can come out and it'll just pass straight through our sympathetic chain ganglia, and it'll go and it'll synapse something called our collateral ganglia. Okay, in our collateral ganglia, same thing, it'll synapse with our postganglionic unmyelinated neuron, and that neuron will go out to our thoracic cavity. And if that's the case, this would be called a sympathetic nervous it does that. Okay? And then another pathway that it can take, the same thing. It's just going to pass straight through our sympathetic chain ganglia. It's going to synapse again in another collateral ganglia, but this time in our abdominal pelvic region. We'll synapse there again with an unmyelinated shorter or longer postganglionic neuron. I'll go out to its effector, and this would be called, if it's below the diaphragm, it's going to be called a splanchnic nerve. Okay? And the last pathway that our sympathetic nervous system can take, so draw a kidney, sitting above our kidney is our adrenal gland, is it can just go straight through our sympathetic chain ganglia. It doesn't synapse, goes straight through our collateral ganglia without synapsing. It just goes straight to our medulla of the adrenal gland and synapses there. In this case, that would release norepinephrine. Okay, so those are our pathways that our sympathetic nervous system can take. And just remember, our sympathetic is going to have a shorter preganglionic neuron and a longer postganglionic neuron. It's got these different pathways. So just remember that. And then this one, where it just goes out to a normal effector and synapses in our sympathetic chain ganglia, this is just via spinal nerve. Okay, perfect. So now let's go to our parasympathetic. We're going to do that in purple. Our cell bodies for our preganglionic neurons for our parasympathetic, they're going to be found in the cranial region. So for that, we're just going to worry about our vagus nerve. Our vagus nerve is kind of the main nerve up there that's going to, carry out parasympathetic innervation. Our vagus nerve itself, 80% of the neurons in it are parasympathetic neurons. So remember that vagus nerve is very important. That's cranial nerve number 10. And then our sacral region as well. So our parasympathetic, that's called our craniosacral region because those cell bodies are just found in our cranial region and our sacral region. And another way to remember parasympathetic nervous system is rest and digest. So that nervous system is responsible for our body's ability to rest and digest. Okay, and the pathways here are parasympathetic. It's just going to have a long preganglionic neuron, and it's going to go right up to the our effector, so right close to our effector, and that's where it's going to synapse with the postganglionic neuron. It's also myelinated. That's going to do that. That's the only pathway it takes. It's just a long preganglionic neuron straight to our effector, where it'll synapse and have a short postganglionic unmyelinated neuron. And that's all it does there. Okay. Now, a thing to remember with our parasympathetic is our parasympathetic is not going to innervate any blood vessels, and it's also really not going to innervate anything in the periphery. It's not going to innervate any sweat glands, no like rector papillae muscles or pili muscles, excuse me. It's not going to anything like that. No skeletal muscle, anything like that. Mainly just organs is what our parasympathetic is doing. So if it asks anything about blood vessels, that's going to be straight up somatic. That's about skeletal muscle, that's most likely going to be somatic, or excuse me, if it's talking about blood vessels, sympathetic, skeletal muscle is most likely somatic. And then organs are somatic and parasympathetic, or sorry, not somatic, sympathetic and parasympathetic can innervate our organs, okay? Now, let's go through, we're going to look at this in a deeper context. I believe that's all we need for this kind of section. So let's erase all this. Now let's talk about our receptors. So the first thing we're going to go over for our receptors is we're going to talk about cholinergic or cholinergic. I always have a hard time pronouncing this, so I'm going to read it really quick. Cholinergic receptors. Let's write out cholinergic. So our cholinergic receptors, they are recepting acetylcholine. This is Cholinergic receptor, it has to have acetylcholine bind to it. Acetylcholine is going to be the ligand for that. And our cholinergic is going to branch out. There's two different types of cholinergic receptors. First, we have our nicotinic, which is going to be our N1 and N2. And later we'll kind of show where these receptors are going to be found and everything. Oh boy, can you even see that? Yeah, you can. Okay, perfect. So our nicotinic N1, N2. One thing to remember about nicotinic receptors is they are always excitatory. No matter what, our nicotinic is always going to be excitatory. Okay, and N1, N2. And the other type that we can have is going to be called our muscarinic. Okay, so our muscarinic ones, that's going to be M1, M2, M3, M4, M5. Usually we just have to worry about 1, 2, and 3. 4 and 5, that's mainly in the brain. But these ones, they can be either excitatory or inhibitory. So a good rule of thumb is if it's odd, it's going to be excitatory. And if it's even, it's going to be inhibitory. Okay? So that's that. And now, moving on to our last section, we have adrenergic receptors. That's not how you spell that, but that's okay. Now, adrenergic receptors, their ligand is going to be what's called catecholamines. So things like norepinephrine and epinephrine. Okay? And also dopamine. I think dopamine's in there. I might be lying actually. Yep, dopamine. So norepinephrine, epinephrine, dopamine. So those receptors are going to be alpha, beta, and dopamine receptors. We're going to have alpha 1, alpha 2, beta 1. Oh boy. That's not how we're going to do that. Beta 1, beta 2, beta 3, and then we also have dopamine 1, dopamine 2. Okay? Same thing here, they can either be excitatory or inhibitory. And it's the same thing, our odds are going to be excitatory, and our evens are going to be inhibitory. Okay? And these are also, they're all like G protein receptors. So ligand's going to bind to it, and it's going to set off kind of this G protein cascade, or like alpha subunit on our G protein is going to kick out, and then it's going to start this whole cascade there. So some other ways that we can kind of bind these or kind of, differentiate them is, so our alpha 1, and then our M1, M3, and M5, M1, M3, M5, those are our IP3 pathways, so they're going to release calcium for, say, like skeletal muscle innervation. And then we're going to have our alpha 2, M2, M4, and our D2. Those are going to decrease CAMP. Okay? And then our D1, beta 1, beta 2, beta 3. Yep. Those are going to increase our CAMP. Okay, so if it has a question about, like, we have an adrenergic receptor, and it increases CAMP and is also inhibitory, then we would know, we could go, okay, what increases CAMP? Here's our list. Which one of those are adrenergic? It'd be our beta receptors. Which one is inhibitory? It'd be our beta 2 because it's an even number. Okay? Just remember those. Those are a good thing to remember as well. Okay? And then another thing to remember is kind of where these all can sit. So let's just go through, let's circle them. So let's start here. So our N1, that's going to be skeletal muscle. So let's go on a skeletal muscle. Our N2, that's going to be on post ganglionic neurons for both our sympathetic and parasympathetic. And then, let's see here, our N3, that's going to be on our eyes, and it causes pupil constriction. It's going to be on like the iris, I believe, and it just kind of constricts, or I guess more the lens. Well, no, I guess it'd have to be the iris, but it kind of constricts our pupils. So remember, eye as pupil constriction. Okay, and then our alpha 1s, those are going to be on blood vessels and also our eyes, but they do pupil dilation. Okay, and then our beta 1s, those are going to be on our heart. And our beta 2s are going to be on our bronchioles of our lungs. Okay, perfect. Now that's it for those. So let's erase this, and we're going to break it down even further and look at individual synapses, kind of how that works. Okay, so let's erase this. Okay. So a concept we need to remember is something called dual autonomic innervation, which essentially just means that both our sympathetic and our parasympathetic, they're working on most organs at the same time. They're innervating those organs, but they're doing the opposite of each other. Okay, so they're going to do the opposite of each other, and just whichever nervous system is more dominant at that point, that's the effect it's going to have, or that's what's going to be carried out. So just remember, dual autonomic innervation, both sympathetic and parasympathetic, innervating the same organ, and they're going to be opposite of each other. They're going to be trying to do opposite things, and just whichever is more powerful, that's what's going to take place. So let's start with somatic. So we're going to have our somatic neuron, and remember that pathway is just one neuron. And it's going to go straight to our skeletal muscle. Okay, and this neuron, it's a cholinergic neuron, which means it would have to release neurotransmitter acetylcholine. Okay, so it's going to release acetylcholine, which means our skeletal muscle is going to have cholinergic receptors. It's going to have cholinergic receptors. So essentially what that's going to mean, it has to have a receptor that accepts acetylcholine. Okay? So in this case, for skeletal muscle, it's going to be our N1 receptors. Okay? Let's do sympathetic. We'll do it in blue. So sympathetic is going to be a 2-neuron pathway. It's going to have a shorter preganglionic. It's going to synapse with a longer postganglionic unmyelinated. And that's going to go to either glands, skin, periphery, or blood vessels. Or organs. We're just going to, well, let's just erase this. We'll just put effector. But remember, those can be effectors of it. So here's its effector. Okay. Now our preganglionic neuron, that is also cholinergic. Okay, so which means it's going to release acetylcholine again. Which means our postganglionic neuron would have to have a cholinergic receptor. In this case, that's going to be an N2 receptor, so nicotinic 2 receptor. Okay, so to carry on that action potential, and then our postganglionic neuron is a adrenergic neuron. Okay, which means it's going to release something like adrenaline. So it's going to release either norepinephrine or epinephrine, dopamine, but we're going to focus on those two, norepinephrine, epinephrine, which means our effector has to have an adrenergic receptor. So it can be our alphas, our betas, our dopamine. We usually just focus on alpha and betas for now. Okay, so that is our sympathetic. Now let's move on to parasympathetic. Our parasympathetic is going to have a longer preganglionic neuron with a shorter unmyelinated postganglionic neuron going to its effector. Okay. Now our preganglionic neuron, that's also cholinergic or cholinergic, whatever it is. Which means, again, it has to release acetylcholine, which means our postganglionic neuron has to have a cholinergic receptor. Same thing, this one is also an N2 receptor, nicotinic 2 receptor. It's always excitatory, just like sympathetic, so it's going to start another action potential. Our postganglionic neuron is also cholinergic, which means it's also going to release acetylcholine, which means its effector has to be a cholinergic receptor as well. In this case, they are our muscarinic receptors. Okay, so let's kind of break it down and see kind of essentially what neurotransmitters are going to do what. So say, let's do, so essentially for our somatic, its neuron releases acetylcholine. Acetylcholine is going to bind to a nicotinic 1 receptor on the muscle. Remember, our nicotinic receptors are always excitatory, so that skeletal muscle is going to get excited and it's going to contract. Okay. And then with our sympathetic, we have our cholinergic postganglionic neuron also releases acetylcholine, and that synapse is going to bind to our N2 receptor on our postganglionic neuron. Always excitatory, remember. So then that is going to bind, start an action potential down our adrenergic postganglionic neuron. We're just going to release norepinephrine or epinephrine, and that's going to bind to our adrenergic receptor. And depending on what kind of adrenergic receptor it is, it's either going to excite or inhibit that. Okay, that effector. Remember, our sympathetic, those are the only things that innervate blood vessels, glands, things like that. And then our parasympathetic, cholinergic, it's going to release acetylcholine, bind to our nicotinic, cause an excitatory potential. Now this other cholinergic postganglionic neuron releases acetylcholine, and then it's going to bind to our muscarinic receptors. Again, depending on where it is, it's going to be either excitatory or inhibitory. Okay? So let's say see how we can practice that. So let's say we have a drug that blocks acetylcholinesterase. So essentially, we're having increases in our acetylcholine at all of these spots. Okay. Now, for our somatic, if we have an increase of acetylcholine, that means more acetylcholine is binding to our nicotinic receptors, which means our skeletal muscle is going to be more excited, or there's going to be more contractions. Okay. That's what's going to happen there. Say we have more acetylcholine, there's not acetylcholine there, so okay. In our sympathetic, if we increase our acetylcholine, all we're doing is we're just going to have more of a nicotinic, or it's going to bind more to this nicotinic 2, so we're going to have more action potentials flowing down this. So it could release more norepinephrine, epinephrine, okay? But then our parasympathetic, we're increasing acetylcholine in 2 spots, so it's going to be turned up more, kind of on both ends. So these receptors are going to be going crazy. So let's say this in our sympathetic is a blood vessel. Okay. So we're going to have cholerogenic. So we're having an increase of acetylcholine, more norepinephrine. Now let's say we're using a alpha 1, or I guess it'd have to be alpha 1 if it's on blood vessels. So our alpha 1s, it's binding to that, it's causing our blood vessels to constrict, which is going to raise our blood pressure. Okay. Now remember, parasympathetic has no innervation on our blood vessels, so it's not going to affect our blood vessels in any way. What it can affect, though, is it can affect the heart. Say via, let's say this is acting on M2 receptors in our heart, hypothetically, okay? So we have an increase of acetylcholine, and that's going to boost these M2 receptors even more, and those M2 are inhibitory, so say that's going to decrease our heart rate. And in this case, if this is an actual person, that is no good. Okay, so there's just some examples of what all those receptors do when one neurotransmitter is increased, what all is going to happen. And that is it for this video. Thanks for watching.